morning. I'm Jill Klischies from the University of Pennsylvania School of Dental Medicine. I'm a public health dental hygienist in the Community Oral Health Department. That's an important question because when we talk about cigarette smoking and how it affects our mouth and oral health, what comes to mind for most people is bad breath or halitosis, stained or discolored teeth, and some people mention their favorite food doesn't taste quite the same. But smoking affects our mouth in so many more ways. For example, cigarette smoking affects the gums and the bones supporting the teeth. In fact, smokers have 2 times the risk of periodontal disease or gum disease as smokers. Cigarette smoke contains nicotine, as well as harmful cancer-causing chemicals like formaldehyde, arsenic, and many others. Nicotine is not only addictive, but it constricts the blood vessels and reduces the blood flow to the gums that's needed to deliver important blood, oxygen, and nutrients to help the tissues stay healthy or to heal if they become damaged. In addition, smoking affects our immune system by suppressing or weakening our ability to fight off infection or prevent disease. Since smokers are more susceptible to getting gum infections from the plaque bacteria left in the mouth, early gum disease can get worse very quickly and progress into a more serious or severe form of gum disease. In addition, smoking often hides the bleeding and swelling that is usually associated with gum problems. So in some cases, people don't realize there's a problem until it's too late. In advanced cases, the infection begins to move into the bones surrounding and supporting the teeth, and they can become loose. If left untreated, gum disease can eventually lead to tooth loss, and cigarette smoking is one of the most common causes of tooth loss in adults. Cigarette smoking can also affect the tongue, and it's a major risk factor for developing tongue cancer. Over time, the harmful and toxic chemicals in cigarette smoke can cause changes to the surface of the tongue that could eventually lead to cancer. That's why it's important smokers keep up with their routine dental exams so their dentist or dental hygienist can examine these areas, look at them closely, and notice any changes that need to be followed or might need to be checked out further. Many people also experience changes or alterations in their sense of taste due to smoking. For example, they may say that food doesn't taste the same or describe things as tasting just a little bit off. The tongue is covered with taste buds to help us distinguish between sweet, salty, sour, or bitter foods. And over time, nicotine and the other chemicals in cigarette smoke can impair or dull our sense of taste. So food might be less flavorful and eating may eventually be less enjoyable. Finally, for many people, tobacco affects the appearance of our teeth. It's not uncommon for smokers to notice staining from the tar and nicotine in cigarette smoke. The tar is sticky and it can stain the enamel or the outer covering of the teeth yellow or even different shades of brown or black if they've smoked for a long time. Tobacco stain can also develop on the roots of the teeth in areas where the gums have receded or pulled away from the tooth. It's important that people know cigarette smoking is not only the #1 risk factor for lung cancer, but tobacco use of any kind, such as smoking cigarettes, cigars, pipes, or using smokeless tobacco products, has been linked for a long time to an increased risk of cancer found in the mouth and throat. In fact, smoking is one of the main causes of oral cancer, and many studies have shown that people who smoke are more likely to get oral cancer than non-smokers. And the risk of oral cancer goes up with the number of cigarettes smoked each day or the longer you have smoked over your lifetime. When you inhale cigarette smoke, for example, you're exposing the tissues in the mouth to cancer-causing agents, we call them carcinogens, that can damage the cells in the mouth and lead to cancer in areas like the cheeks, the gums, roof of the mouth, or under the tongue, or even in the back of the throat, where it can be hard to see. Every time you smoke, these tissues are exposed, and eventually precancer or cancerous areas can develop. Also, as I mentioned earlier, smoking decreases how well the immune system works so it can be harder or more difficult for the body to prevent or fight off the cancer cells from forming in the mouth. Overall, the important message is that any type of tobacco use in any form is just not safe. Here's some good news, though. Since oral cancer refers to cancers found in the mouth or throat, the dental team plays an important role in early detection and prevention. Some patients see their dentist more often than their primary care providers, so routine dental exams and cleanings are important opportunities for the dentist or the dental hygienist to notice any early changes in the mouth. An oral cancer exam is generally completed at least once a year or can be more frequently for people who have a higher risk of oral cancer, such as smokers or those that have a previous history of oral cancer. Dental professionals complete oral cancer screenings and examinations by looking closely into the oral cavity and paying special attention to any unusual white or red areas around the tongue, inside the cheeks, perhaps on the gums and lips, that may indicate a need for further follow-up. The dentist may also feel or palpate areas around the neck to check for any unusual lumps or changes in the tissue. Patients should also feel comfortable letting their dentist know about any new or unusual red or white patches in their mouth or lumps or sores that get larger, don't heal, or don't seem to go away within a few weeks. And finally, don't forget that dental professionals have been trained to talk to patients about their tobacco use and provide information and assistance with tobacco counseling and recommend strategies for quitting. The dental team plays an important role in prevention, early detection, intervention, and saving lives. Unfortunately, smoking can affect or interfere with the healing process after procedures like tooth extractions, periodontal surgery or gum surgery, and even dental implants. Smokers have an increased risk of complications like infection or slower healing in and around the extraction or the surgical site, so they may take longer to recover compared to non-smokers. For example, as I mentioned earlier, cigarette smoke contains nicotine and other harmful chemicals that reduce the important blood flow, oxygen, and nutrients needed for the tissues to heal properly and quickly without complications. The reduced blood flow and possible irritation from chemicals in the smoke, combined with effects smoking has on the immune system, can make it harder for the body to fight off infection from the plaque bacteria in the mouth. Smokers should also be aware of the risk of developing a dry socket after a surgical procedure. A dry socket can happen when the suction created by inhaling during smoking, or even using a straw, too soon after an extraction can loosen or remove the important blood clot that's needed to heal the area. Since a dry socket can be painful and can delay the healing process, you should always refrain from smoking soon after oral surgery and report any concerns to your dentist. Another important consideration is the effect that smoking can have on dental implants. Since dental implants are used to replace missing teeth, they need to be supported by healthy bone and be secure. Smoking can delay the healing process after implant surgery, and it can increase the risk of the implant failing. People need to be sure to talk to their dentist if they're interested in getting dental implants, to be sure that they're a good candidate and likely to have a good outcome. The important message is that if you're interested in getting dental implants, you should stop using all tobacco products before and after in order to increase your chance of getting good results. That's a great question, and the good news is that there are lots of ways that your dentist, your dental hygienist, or other members of the dental healthcare team can assist patients in quitting. As a dental hygienist and oral healthcare provider, one of the most important questions I ask every patient is whether they smoke or use tobacco products and if they're interested in quitting. I view every dental visit as an opportunity to let patients know how quitting can improve their oral health and their general health, and that I'm here to help them and provide suggestions on best ways for them to quit. There are many strategies that can be used to help patients to quit, but the most successful combine the use of brief behavioral counseling along with the use of nicotine replacement products like the nicotine patch, gum, lozenge, nasal spray or inhaler, or even prescription medications. In fact, counseling and medications together can double the chances of quitting. In addition, we found that combining both short and long term acting nicotine replacement products, like the patch, in conjunction with the gum or lozenge, can also increase the chance of quitting. Fortunately, except for the nicotine nasal spray and the inhaler, products like the nicotine patch, gum, and lozenge can be purchased over the counter and found in most pharmacies or other stores. The nasal spray, inhaler, and medications do require a doctor's prescription. Regarding behavioral counseling, when someone first decides to quit smoking, I encourage them to set a quit date within 2 weeks. A quit date can help to confirm their commitment to follow through with their quit plan and to provide a personal goal for them to reach. Next, I suggest they tell their friends and family and other people that they see often about their decision to quit smoking. This can be a really great opportunity to ask for their support, especially during the first few weeks when nicotine withdrawal can be the strongest. Reducing any temptation to smoke is also important. For example, removing tobacco products or ashtrays from the home can help, or avoiding places you used to smoke can decrease the likelihood of starting again. It's also important to discuss the nicotine withdrawal symptoms that many patients experience, especially in the first few weeks of quitting. For example, some people find they're more anxious or irritable, or they may feel restless or have trouble sleeping. Exercise can help, even if it's just a short walk. Deep breathing or calling a friend for support may help them get through their craving for a cigarette. Some people find they also get hungrier when quitting smoking. They tend to snack more throughout the day. Increasing their intake of fresh fruits, vegetables, and other healthy foods, plus drinking more water, can be helpful. Finally, I'm always sure to let patients know that there are many helpful resources available. For example, I always share the 1-800-QUIT-NOW toll-free state tobacco hotline that provides one-on-one counseling and sometimes free nicotine replacement products. Many communities as well and local hospitals have tobacco cessation programs, and many online websites such as smokefree.gov and others offer information, text messaging, and apps that can help support smokers' attempt to quit. Sure. So, secondhand smoke and smokeless tobacco products affect your oral health and your overall health and should never be considered safe. For example, many people are surprised to learn that secondhand smoke, or the smoke we breathe coming from the end of a cigarette, or smoke that has been exhaled and kind of lingers in the air, contains many of the same harmful cancer-causing chemicals and risks that you get from smoking. Repeated exposure to secondhand smoke can raise your risk of cancer in the throat in areas like the nasopharynx, which is the area behind the nose, and even the voice box or the larynx, and also sometimes even in the nasal sinuses. Smokeless tobacco as well, people can also easily be misled into thinking that smokeless tobacco or spit tobacco products like chew, which is a loose leaf tobacco, or more finely ground products called dip or snuff that are held between the cheeks and gums or under the lips are safe alternatives to cigarette smoking. This just isn't true. It's important that people know smokeless tobacco is not safe and is associated with many oral health risks. For example, these products contain nicotine, which we know is addictive, but they also contain the cancer-causing chemicals that are absorbed through the tissues in the mouth and linked to mouth and throat cancers. People who use smokeless tobacco products have twice the risk of developing cancer in places like their lips, cheek, tongue, and gums, because these are all common areas that come in direct contact with the tobacco. Over time, some people may develop white patches in these spots, which we call leukoplakia, and they can be precancerous changes in the tissue and could eventually lead to oral cancer. The risk for throat cancer, esophageal cancer, and other cancers of the digestive tract increase as well from the tobacco juices that are sometimes swallowed when using these products. It's also important to mention that many smokeless tobacco products contain sweeteners that are added to improve their taste. The sweeteners can raise the risk for root decay on the teeth that are near the spots where users hold the tobacco, such as inside the cheeks and between the lower lips. Some smokeless tobacco products are also gritty and they're abrasive, which can cause wear on the teeth and can contribute to gum recession.